We're pleased to be joined now with the Medical Director for the Oakland County Health Division, Dr. Russell Faust, to talk more about the COVID-19 situation and more here in Oakland County. Dr. Faust, thank you for being with us today.
For the invitation.
Appreciate it. So right now, the Delta variant, of course, is the topic of conversation on COVID-19 across the nation, really across the world. In terms of Oakland County and in terms of southeastern Michigan, what is the current situation in terms of the Delta variant as we continue to see cases start to rise across the state?
It's a great question. You know, I don't have exact data for Oakland County, but in the state of Michigan, according to MDHHS, we have greater than 90% that is the Delta variant.
In an article from Oakland County 115 earlier on this week, you were quoted in saying, in light of a recent rise in COVID-19 cases, which includes the Delta variant, we agree with the recommendation from the CDC for all Oakland County residents to wear masks and social distance in public indoor spaces, regardless of vaccination status. And some may respond to that by going further on into that article with some of the data and say, why do we need to do that when 70.6% of Oakland County residents are currently fully vaccinated against COVID-19, have received at least their first dose, and over 85% of cases have been among residents younger than 60 years old. What do we need to wear the masks for at this time, Dr. Faust? Why is mask wearing once again so critical as our vaccination rate in Oakland County continues to be stellar in comparison to many other areas in the state of Michigan?
Yeah, we should be, all of us in Southeast Michigan, congratulated for achieving those numbers. But the fact is that 70.6 is just those above the age of 16 who have received at least one dose, not those who are fully vaccinated. We're something around 60 or 65% fully vaccinated, which is unfortunate. The issue is that now that we're in a, quote, substantial transmission geography area, according to CDC definitions, that means that we continue to have transmission. And the problem that we're having is that we will begin to see breakthrough infections. That is, those who are partially or fully vaccinated will be infected by those who are completely unvaccinated. You know, the fact is there's no vaccine that's 100% effective or 100% protective. These vaccines, you know, are like any other. We're fortunate in that these vaccines have a very, very high level of protection. But even if they're at 90% or 95%, that means we still have a 5 or 10% risk of being infected. That is a breakthrough infection. What we're seeing with the Delta is that there's a higher risk of breakthrough infection. And there are reports globally from other places, the UK or Israel, that those who are fully vaccinated are becoming infected with Delta. We're not seeing that here yet. We have doubled over a 2-week period, doubled the number of people who are infected with COVID, who are admitted to our hospitals. So far, those who are fully vaccinated are not among them. So far, the Delta variant that is circulating here is not infecting people who are fully vaccinated. So we're fortunate. But the fact is, every active infection, whether with Delta or some other variant, every active infection is a factory of mutations. It's generating more variants. And so people that get infected with Delta are generating Delta plus variants. And what we're seeing globally is there are locations, I think out of the UK most recently, where there are many infections, breakthrough infections of people who are fully vaccinated with these newer Delta variants. So that's a long, rambling way to say we have the ability to put a stop to this. We need to get everybody, as many people as possible, vaccinated, and we need to get people back in masks, whether they're vaccinated or not, when they're indoors. And you know, my biggest concern right now is that we're kind of headed toward this perfect storm. That is, we have schools are about to come back into session. Many of those children are unvaccinated and can't be vaccinated according to FDA rulings on the vaccine so far. We've got people that are returning to work from remote situations. We've got schools, colleges, and universities that are coming back online and back on campus versus remote. We've got international travel opening up. We've got international students arriving back on our campuses, and we've got Delta variant greater than 90% in the state of Michigan. I'm concerned. And again, this is not rocket science. We have the ability to put a stop to these transmissions: vaccine and masks. And again, I apologize, it's a long, rambling way to answer your question.
There's so much to unpack here, and just listening to you talk, there's so many questions I now want to ask. But on the topic of this perfect storm you say we're going into, and schools starting, and the FDA not allowing children to be vaccinated, explain a little bit more why that is. Why aren't children under, I believe it's still 12 years old, unable to be vaccinated? And because of that, is mask wearing going to be enough in schools to stop the transmission until they can be vaccinated?
It's a great question. So I'm not sure. I don't have a great explanation for why FDA and CDC haven't approved for those younger than 12 to be, vaccinated. I will say they're being very, very cautious. And, frankly, as a parent, I think that's a great idea. I fully support their level of caution, so that we don't end up with, with an imbalance that is of children who are having kind of unforeseen complications of being vaccinated versus the benefits of being vaccinated and keeping them from incurring infections with COVID-19. So right now, I support the FDA's hesitancy and caution. So I think they're just waiting for more clinical trial data. We know that those in school can prevent transmission with not only masks, but also distancing. So that combination, which has been so successful in the past, will continue to work as long as we continue to mask and distance.
We're joined by Dr. Russell Faust, the medical director of the Oakland County Health Division on the Oakland County Megacast. And Dr. Faust, as we continue forward through the pandemic, as cases continue to be rising across the state of Michigan, we have, of course, the Delta variant in play. If people are more apt to get vaccinated, is Oakland County continuing to have those pop-up clinics throughout the county? And what are some of the places or dates that those may be coming up on?
Sure, and thanks for that question. Yeah, I do miss the days of having, being able to vaccinate 4,000 people in a day. Mm-hmm. Certainly, as we move through the greatest demand for vaccine early on in the pandemic and the availability of vaccine, demand is reduced. And in order to get out and get people vaccinated, we're trying to make that as frictionless as possible and reduce any obstacles. So right now, vaccine is available anywhere and everywhere. It's available through medical practice groups. It's available through pharmacies. It's available, we go out and support vaccination clinics at faith-based organizations, churches. We're going out into neighborhoods. We have a mobile van that goes around. I know that Honor Community Health has the same. We're going out into communities now where there are small pockets of under-vaccinated, population and bringing vaccine to them. So there are no obstacles. So they don't have to come to us. We continue to run vaccine clinics, make vaccine available at our North Clinic in Pontiac, our South Clinic in Southfield. And let me be very clear, it's free of charge. So we're trying to make it as available widely as possible and as frictionless as possible.
Dr. Russell Faust with us on the Oakland County Megacast. He is the medical director of the Oakland County Health Division. And Dr. Faust, we've heard a lot about the Delta variant. We're starting to hear a lot about other variants that are popping up in the U.S. and certainly across the world, such as Delta Plus or Gamma. And now we're starting to hear about the Lambda variant. And there's there's a variety of information on these various COVID-19 variants, and particularly with the Lambda variant, there's still conflicting information, or more studies need to be conducted from the medical community as it's currently being reported in terms of its ability to spread and certainly its ability to counteract the vaccine. In the medical community at this moment in time, how great of a concern is that potential for one of these variants that will continue to pop up as people continue to not be vaccinated and as COVID-19 continues to spread in the U.S. and around the world? Is the concern about a variant that could jump the virus in some way or another, jump the vaccine in one way or another, a growing concern for the medical community?
Yeah, that's a great question, Tyler. Thank you. So right now, when I do a daily kind of research in PubMed and medical journals looking for clinical data, medical data, scientific data on the various variants. And right now, there isn't really great data on the resistance to vaccination or the transmissibility or infection rate on Lambda, for example. So I think this is a great opportunity to emphasize that I want to strongly encourage people not to get their medical, clinical, and scientific facts off of social media sites, whether that's Twitter or Facebook or some other, social media blog. I want to strongly encourage people to go to cdc.gov and look for current updates on vaccine, about variants, and they're great at being very, very transparent on what's going on and possible side effects as they are learned about through clinical trials. So cdc.gov is a great site. The World Health Organization has a similar site, WHO. That's the place to get clinical and scientific fact, not social media. The other thing I'd like to emphasize, at the beginning of this pandemic, a new phenomenon has popped up in scientific and medical literature, and specifically the preprint. And so as the medical community was trying to get information out as rapidly as possible, they would preprint articles online. And what that means is they don't go through the normal vetting process of peer review. That is, an editorial review panel reads the paper, they look at the data, they review and confirm the statistical analysis, the setup of the clinical trial, and confirm that it's been conducted properly. None of that is happening right now for many of these preprints that are posted online. And what happens is they get posted, the data is preliminary, it's not confirmed, and then somebody picks it up and puts it out on social media without it truly being confirmed or vetted. And so a lot of the misinformation that we hear about is coming about in that pathway. And again, we won't see that on cdc.gov. So I want to encourage people to go to cdc.gov for their clinical and medical facts.
Dr. Russell Faust, the medical director of the Oakland County Health Division, with us on the MegaCast today. And as things continue to remain open, and as we get into the thick of the late summer and into the fall, as kids are, of course, soon to be returning to our schools, what is your recommendation right now in terms of precautions that should be taken outside of vaccination, of course being the best precaution that can be taken against COVID-19 at this time, for parents as they're preparing to send their kids back to school, for older children and, well, emerging adults in that case that may be returning to college campuses in our local area, and for businesses that are in more cases now than before, starting to return workers to the office while the spread of COVID-19, of course, continues?
So, as you point out, the best protection for all of us is vaccination. In addition, if you have children returning to school and they do not fall into the vaccinatable category, 12 and above, it's important for other family members who are eligible to be vaccinated, and that will keep their children as safe as possible. In addition, masking and distancing, and confirming with the school superintendents or principals that those precautions, those mitigating activities are being used in the school campus. A lot of schools have done away with the hybrid or remote option, and I can fully understand that. And parents simply need to express their wishes with the school superintendents and principals. They have really a thankless task before them, as parents on both sides are really pressuring them. But parents can do everything they can possibly do to keep their children masked, maintain distance, conduct as many activities as possible outdoors, considering that we're headed back into colder weather. But vaccinate the rest of the family as possible, and mask and distance.
Dr. Russell Faust with us from the Oakland County Health Division. He is their medical director. And Dr. Faust, just another couple minutes with you before we'll say goodbye today. We recently had the first confirmation of mosquitoes with West Nile virus in the Oakland County area in Troy. For those that are trying to take precautions against this potential threat to people's health, what should they be aware of at this time? What should they maybe be avoiding? And if they do come in, and what symptoms should they be on the outlook for in case they are stung by a mosquito that is West Nile virus positive?
Sure. So again, great questions. If as possible, minimize activities at dawn and dusk, and thereby minimize your exposure to mosquitoes. If you're going to be outdoors, long sleeves, long pants, again, to minimize your exposure, and use a DEET, D-E-E-T, containing repellent. And the symptoms are, begin with a severe headache and kind of decreased cognition. So if you've been exposed, you've been outdoors camping or what have you, you've been covered in mosquito bites, and you're feeling ill, then you should be seen by your practitioner.
Dr. Russell Faust from the Oakland County Health Division with us on the MegaCast today. Just another couple minutes with you, Dr. Faust, before we say goodbye. Anything else that you think is important at this time for our audience to know about COVID-19 or other health matters in the Oakland County area?
No, really, I appreciate the opportunity. Thanks for the invitation. I did want to thank Fire Chief Greg Flynn for his kind comments, but also for his partnership and service in our community. It's been great to partner with the fire teams in getting people vaccinated. So thank you.